Hi, Dr. Chris Gubbles from Square One Health, and today I'm going to show you a full body CARS routine that you can do every single day to put all your major joints to a full range of motion. CARS stands for Controlled Articular Rotations, and we want these motions to be very controlled and isolated at each specific joint. So I'm going to start off just with the cervical spine. In the cervical spine, what you're going to do first, you're going to tuck your chin, then you're going to rotate over to your shoulder, then you're going to tip your head back, rotate all the way around, chin down, rotate back to center. Then I'm going to go back the other way, turn my head as far as I can, tilt my head back, rotate all the way around, come back to neutral. So doing that each way 2 times is great for the cervical spine. Then we're going to move into the thoracic spine. This is great to get some mobility, rotation in your thoracic spine. To do this, I'm going to cross my arms and I'm going to flex forward. As I flex forward, I'm going to turn to the side, then I'm going to crunch over. Then I'm going to be bringing my back into extension as I work all the way around to the other side. Then I'm going to come here, pinch down, rotate back to center. Rotate over, pinch down, extend as I rotate all the way around to the other side, pinch down, rotate back to center. So I would do that both ways. We're going to do one more for the thoracic spine and the full spine when we go down on our hands and knees. Next I'm going to move on to the shoulders and the scapula. And what I'm going to do is I'm going to rotate my shoulders forward, elevate them up, rotate them all the way backwards, and then bring them down. Then I'm going to go in reverse, up, forward, down, back. Again, I would do each of those both ways 2 times. After we do the scapula, we can move on to the actual shoulder itself. Now the shoulder, you got to be careful because you want to make sure you're isolating the shoulder and you're not moving your thoracic spine and getting a bunch of turning and twisting in the body. It's great to have something that you can use to stabilize yourself. Now I'm going to start off in an anatomical position with my hands forward. I'm going to start by adducting my hand. I'm going to bring it forward as far as I can. I'm going to bring it around until I hit my maximal spot of rotation. Then I'm going to turn my hand and I'm going to bring that back. And I'm going to end an extension with internal rotation. Then I'm going to go in the opposite. As I bring my hand on forward, I'm rotating and I'm bringing that around. So again, keeping my trunk stable, I'm isolating that movement to my shoulder. Forward, back, all the way around. As I come back, I'm gradually rotating my shoulder. I would do both shoulders at least 2 times on each side. After my shoulders are warmed up, I'm going to move on to my elbows. The elbows are real simple. Just going to bring your hands forward all the way, flex them, or pronate your hands all the way down, back, supinate, down. I would do each of these 2 times. After my elbows, I go into the wrist. The wrist, if you want to isolate the wrist, make sure you're not moving the arm. You can stabilize your forearm with one hand while you put your wrist through full circulation, both ways. However, I have it pretty controlled, so I will do those both at the same time. Now I've just done my tight upper body, so I'm going to move into the lower extremity. The hip I'm going to do while I'm standing. Again, we want to make sure we're isolating the hip joint itself without moving the pelvis. To help do that, I'm going to stabilize myself by grabbing some kind of support. With the hip, you're going to bring your hip into flexion and adduction. Then you're going to abduct as far as you can. Then internally rotate and bring your hip back into extension. Do this opposite, bringing it around and back down. Again, as I bring my leg into flexion, I have it just across the midline. I'm adducting it. Then I'm going to externally rotate, bring my knee in and back. This is one of the harder ones for people to do, but you're trying to make sure you're not doing this kind of stuff. Just keeping that isolated, putting that joint through full range of motion. After I do my hips, I'm going to move on to my knees and then my ankles. So when I'm doing my knee, I'm just going to support myself, my thigh right here, and what I'm going to be doing is rotating my foot in, like this. I'm literally rotating the fibula. I'm going to go all the way in extension, externally rotate, and flex. Boom, boom. You're just going to do that a couple times. From here, I'm actually going to do the ankle, and I'll come back later and we'll do the kneecap. When I do my ankle, I'm going to isolate and stabilize both the fibula, and the femur. So I'm going to hold it just like this, and I'm going to be doing full range of motion, circles, with my ankle each direction. To finish off the lower extremity, I'll do my kneecap. Now, with the kneecap, I'm going to have my leg extended. There shouldn't be tension in my quads or my hamstrings. And what I'm going to be doing is just moving my kneecap in little squares. So I'm literally moving my kneecap like this and then back in the opposite direction. 2 or 3 times each way is excellent. And I would obviously do both legs. And the last thing we're going to do is we're going to do an additional full spine exercise while on hands and knees. I'll use this table to make it easier to see. I'm going to be starting down in my pelvis, the sacrum, and gradually moving all the way up to my cervical spine. And I'm going to start off by tucking my sacrum, little by little, arching my back as high as I can, and then bringing my neck to flexion. And I'm going to go in extension as I work all the way down like this. Then again, I'm going to tuck my pelvis into flexion, slowly round my back all the way up. Cervical spine, and extension, all the way down. And that right there was a real simple routine to put all your major joints through full range of motion. Now, you don't want to be doing things with pain. If any joint has pain, you should have that evaluated by a healthcare professional. And this is a great tool to keep the current amount of range of motion you have with your joints, and you'll probably even add a little extra range of motion. These should be done every single day. All your joints require full range of motion every single day of your life.